scream until we're satiated. Scream! Thank you, I needed that.
We have a wide array of people here from the United States and from all over the world. We have people from Afghanistan, from Australia, United Kingdom, a lot of people from Canada, a lot of people from East Africa and Eastern Europe too. We have people from Ukraine, Lithuania, Russia, and a lot of the people from other countries are coming to learn from what we're doing in the United States. But a lot of people from the US are exchanging ideas with each other about how they approach working with people who use drugs. For example, we have people who have come across injectors who inject into their groin, which you don't see very much in other parts of the country. So they're exchanging strategies as to what the education needs are for drug users to do that, and how you address it. We have people that are looking at how you approach people who use crack. You know, we haven't done a lot around crack use in this country on how to work with people who use crack. You know, clearly we have problems associated with crack use, but there are things you can do to undo some of the damage as if you're continuing to use crack. So it's really an exchange point in some ways. It's a networking opportunity. It's a way of building camaraderie. And in a sense, we're a tight, small little community. But what we do here is train ourselves, support each other, and then you go out into the wider world and our messages are then disseminated that way. So it's a big seeding process in some ways. I mean, if you look at what we've done around HIV transmission, for example, the work we have done, which was very often against federal policy in some ways because, you know, we've gone through some very conservative times. The work we've done around syringe exchange has reversed HIV epidemics. In places like New York City, which at one point was the drug injection and HIV epicenter of the globe. We've completely reversed that through the work we've done. And on the other hand, in places like California and Washington State and Oregon, we've prevented epidemics from ever occurring. So we've been doing this for a while now. So you look at what happens amongst young injectors and new injectors, and you're seeing a lot less of hepatitis C transmission, which is a very transmissible virus. It used to be that 80% of drug injectors had hepatitis C within 6 months of injecting. Now what we're seeing is that younger injectors, it's a lot lower than that, and it takes a lot longer for them to contract the virus. This is a result of our work. These are lives that have been saved. You look at drug overdose prevention, we are training drug users, we're training service providers, we're putting tools into the hands of drug users who use opiates to prevent an overdose fatality. A lot of drug users are on site when another drug user overdoses. And in the past, what they did was panic in some cases, or try street law remedies such as injecting people with milk or salt or putting ice down their pants. Now we teach people how to do rescue breathing, and we give people naloxone, which is an antidote drug for heroin overdose. So this is very directly saving people's lives, and we've kind of done that within our own communities, taught people how to do this, and they've gone out and done it. And a byproduct of that is you see places like New York State Department of Health, New York City Department of Health, San Francisco Department of Health, Massachusetts Health Commission, they've all taken these ideas on. They have adopted these ideas and have now disseminated them, and they're funding them, and they're giving us recognition that what we have learned and what we've taught ourselves is worth doing. And what we are trying to do is get the federal government also to take notice. And with the lifting of the federal ban on the funding of needle exchange, they've begun to do that. So we've made a lot of progress over the years. You know, I think we know from HIV figures in this country that the epidemic hasn't gone down. It's remained pretty much stable, except amongst people who use drugs. And that's because of the work that we do, and because drug users are incredibly receptive to information about reducing HIV risk, and they practice it. You know, drug users really do care about their health, and that's kind of messages we want to put out there too. You know, a lot of what this conference is about is anti-stigma messages. We have a massive propaganda exercise that's been taking place for decades now in the form of the war on drugs, which is really about stigmatizing people who use drugs and stigmatizing the communities they come from. People internalize that stigma. They begin to believe that they really don't care about their health, or that they're incompetent and they can't look after themselves and their loved ones. And that's just not true. They can, with the right support and the right education, they can work miracles.